Welcome to your conference call entitled Guide to Developing a Written QAPI Plan. My name is Jason, and I'll be your operator for today's call. At this time, all participants are in a listen-only mode. Later, we will conduct a question-and-answer session. I will now turn the call over to Christy Werdine. You may begin.
Thank you, Jason. And hello, everyone. This is Christy Werdine with Stratus Health, the Minnesota organization that's part of Lake Superior Quality Innovation Network, or the Lake Superior QUIN. Lake Superior QUIN represents Minnesota, Michigan, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. I would like to welcome you to this educational session entitled Guide to Developing a Written QAPI Plan. All lines will be muted during the webinar. However, after the presentation, we will have a time for questions and answers, so please make a note of any questions that may come up as you listen, or put your question in chat, and we will address these questions at the end. Because MetaStar is providing continuing education credit for this presentation, we need to inform you that no commercial support has been received for this learning activity. Jane Peterson, our speaker this afternoon, has reported no conflicts of interest, and there are no planner conflicts of interest. For CE credits or a certificate of attendance, you must attend the entire session and complete an online evaluation. We encourage everyone to complete the evaluation to provide feedback on the session. Dr. Jane Peterson is our speaker for this webinar. She's the Chief Medical Quality Officer at Stratus Health. In this role, she provides leadership and clinical guidance to Stratus Health's healthcare quality and safety initiatives. She was on the leadership team for the Centers of Medicare and Medicaid Services Quality Assurance and Performance Improvement, or QAPI, demonstration project, and she supported the development and implementation of the QAPI program through the development of tools and resources. Dr. Peterson is board certified in internal medicine and geriatrics, and she maintains a clinical practice in the long-term care setting. She's an active member of a number of healthcare societies and committees, including the Minnesota Medical Director Association and the Minnesota Medical Association. She serves on the Board of Examiners for Nursing Home Administrators and participates in state work groups that focus on topics relevant to older individuals. Jane, I'll turn it over to you.
Thanks, Christy. Good afternoon, everyone, and thank you so much for joining us. Could we advance the slides over to start with the objectives? So this is what we'd like to cover today. We'd like to first talk about what is the purpose of developing a QAPI plan, and then spend a lot of our time looking at actually how to use the Lake Superior QAN QAPI plan guide to help you develop your organization's specific QAPI plan, and then spend a little time outlining next steps in the development of your plan. I want to remind everybody, and I think Christy had sent out a notice ahead of time, that it would be really helpful for you to have the how-to guide in front of you, a paper copy of that, because I will be referring to some of the pages within that. So if you hear me shuffling some papers, I have a paper copy in front of me as we walk through some of the slides, because this is meant to be a working presentation. So first, let's just kind of step back for a minute and remind ourselves that QAPI is really part of a bigger purpose. It's about making change within our organization, and specifically making changes that lead to improvement. One of the other tools that's out there that we like to continue to remind people about is the change package. It really contains a lot of those concepts that we want to try to keep in mind as we're doing our QAPI work. It helps us think a lot about how systems change really helps us in our organization and helps us make us good systems thinkers. The other part of the QAPI plan that fits along with some of the concepts in the change package is being able to really track our progress, and then, of course, that concept of small tests of change, being able to plan and implement tests of change that continue to move us forward, because doing those small changes and doing them quickly can help us move forward much more quickly and efficiently. So why in the world do we want to develop a written QAPI plan? Well, probably one of the first answers that everyone's going to give is, well, we think it's going to be a requirement. But really it's a bigger issue than that. Your QAPI plan should be something that really reflects your organization. And so this slide talks about what is the purpose of a written QAPI plan. And that is to guide your organization in implementing an effective, comprehensive, data-driven QAPI culture that improves resident outcome and quality of life. What's not said in that statement is that this should not just be something that sits on a shelf. I think there's a lot of times, we feel like, this is a requirement, we have to fill it out, okay, wipe our hands, that's done. This is much more, your QAPI plan should be much more like your strategic plan for how you're actually going to tackle this work in your organization. And so even though we provide you with some examples as we go along in the how-to guide, this should not be a generic plan. It really should be something that reflects your organization and the unique residents in your organization, the unique services you provide, and how you really want to bring QAPI to life in your organization. So again, the plan, well, yes, it might be a requirement, really is something that you should look at as a way to be your guide, to be something that you can refer to, and should be something that isn't just set on a shelf. A little bit on the QAPI proposed rule. Many of you probably are already likely familiar with this language, but it states that each long-term care facility must maintain documentation and demonstrate evidence of a QAPI program. QAPI plan will be made available to the state agency, federal surveyor, or CMS upon request. So, this isn't something that CMS is going to want everybody to mail in their They probably wouldn't even know what to do with that many QAPI plans coming in the mail. But it is something that as you're putting it together, you want to make sure you have a level of detail and that you put time in it so that when somebody does ask you for it, it really does reflect what you're doing. And hopefully as we go through some of the examples, we're going to give you some ideas of kind of how to hit that degree of detail that makes it useful, but not so specific that you have a QAPI plan that is hundreds of pages long that you can't keep up with, that isn't a useful tool. So what we're going to try to help guide you through is how do you hit that level of specificity and detail that reflects your organization, is useful, but is also something that's efficient and effective for you to use. So I guess let's get down to some business here. How do you write a QAPI written plan? So this is the time for you to get out your how-to guide. So if you have it in front of you, this is your time to open it up, to look at it. So let's start with the table of contents. Basically, it's a table of contents. It tells you the various spots that each of the different sections start on. The initial part, the written plan introduction, is just a quick summary. Covers some of the things that I just talked about, but also has you start thinking a little bit about what this plan does for your organization. The next slide is the end of the written guide, and that is the appendix. And what you'll see here is a list of all the templates, sections, and just blank tables. So what this is these are all the pieces that are actually part of the how-to guide. These are templates. They're in Word documentation so you can add, subtract, you can modify, and make it your own. But so this is all the pieces that you'll need as you go through. So let's flip back to closer to the beginning. So this is on page 3, and this is the purpose. So the first thing that QAPI plan asks you to do is write your purpose. As you'll notice, it talks about your vision statement, your mission statement, and your guiding values or principles. This is the part that requires your team to sit down and do a little reflection before you get into actually filling out any of the templates. Pulling out your mission and vision for your organization and maybe coming to some understanding about how you really want QAPI to look within your organization. What do you want it to do for you? How do you want your organization to be better next year or the year after because of QAPI? Not because of the regulation, but because of how you're going to approach this work. So spending some time on writing the purpose statement and answering that prompt will really help you set a good foundation for your QAPI plan in general. So now let's flip over to page 5. And you'll recognize this laid out in the elements of QAPI. So it starts with scope. And you'll see each of the sections, except for the feedback, data systems, and monitoring, are laid out similarly. We have a set of prompts for you to answer, and in each one of those, we've given a little example. We hope that you don't just cut and paste our example, but feel free to use that if it gives you some ideas. But they're meant to be a starting place for you. Again, each of these answers, you don't feel like you have to write chapters and chapters, but it should be something that concisely states how your organization is going to meet each of these prompts. So, like for the first one under scope, the list of services. This is really thinking, okay, so what do we provide? Some of these may be very similar to what other organizations provide, but some of them are unique to your organization, and it just gives a picture of who you are. And then how will your QAPI plan address some of these key issues? So again, thinking about the basics, clinical care, quality of life, resident choice, what are some of the things that you want to do with QAPI that are going to address each of these? So that's how the scope is laid out. I'm not going to go through each of these examples further, but I do also want to call your attention to the resources that are at the end. And in each of these sections, you're going to have resources that we've pulled that we think might be helpful to you in writing that section. You'll notice some of them are other QAPI tools, so some of them come from QAPI at a glance, but then there's also some tools that we've pulled that aren't part of the QAPI work that also fit into each of these. And so you should be able to get the links off of each of those, and it would be good to review those as you're trying to put your answers together. The next one, governance and leadership. Again, it's laid out the same way as scope. In this one, there's 6 different prompts that you're asked to address, and each of these, again, should reflect your organization. What's unique about your governance and leadership? How are you going to address each of these, not in the generic, but as it's specific to your organization? And then again at the end, there's some resources. A couple ones you may not have thought about, but like examples for performance objectives for job description and performance reviews. So if you're going to have this as part of your governance and leadership or part of anyone's role in the organization, maybe you actually build this into their performance objectives. How do you start building this into job descriptions so that when people come into your organization, they see right from the beginning that quality and performance improvement is something that you value, that's really important to you and important enough that you're going to evaluate and your employees on how well they can contribute to that. So the next section is the feedback, data systems, and monitoring. And this, I'd like you to turn to page 10, because I'm going to walk you through how this section is laid out, because it's a little bit different than the first 2. In feedback, data systems, and monitoring, we have 3 kind of classifications of data sources. The first is data sources to analyze performance, the second, data sources to identify risk, and the third, data sources to collect feedback and input. So what you'll see on page 10 is kind of that generic template that you can use. So if you're completing that, so if you start in the upper left-hand corner where it says data sources, so if you're looking at data sources to analyze performance, you can start filling in that column which data sources you're going to use. In the boxes below, the ones that say, where it says suggested data sources, we've given you kind of a starter list, something that you can pull from. We don't want you to feel like you have to use all of these. You may have other ones that you'd like to use, but really pick and choose from what data sources you really do think that you're going to be actually using. I wouldn't put data sources in there just because you feel you should be expected to use that data source, because if you are asked for your QAPI plan and you have a data source in there that you say you're going to use and you're not actually using it, you just put it there because you think, oh gosh, they'll want us to use this one, but you're not really using it, that doesn't reflect what you're actually doing. Put the ones in there and say, these are the ones we choose, this is why we're doing them, and this is how we're using them. You can always revise it the next year if you're, revising your QAPI plan at intervals, which you should be. You can take one off. You can add another one on. If you find, gosh, we're looking at this resource and it's not all that helpful, we'd like to look at something else, move that into its position and take it off. So try to keep these, for each of these, try to keep this list manageable and things that you're actually looking at. So just a little bit more on the template. So now we kind of talked about that far left column of data sources. Let's just walk through the other columns. The next one is the data collection frequency. And we just put some general suggestions, may want to break it into, do we want to look at it weekly, monthly, quarterly, annually? You could choose to put, if you have specific dates, you can choose to put whatever you'd like in that, but it should just realistically reflect how often you plan to look at that data in regards to when it's available. If it's data that's only available quarterly, well, you probably don't need to look at it weekly or monthly, and so it helps you kind of sort out not only how often you want to do it, but what kind of your workflow as well. The next one is, are you going to use any kind of benchmarks when you're analyzing this? So what's your goals? Are there, other identified best practices out there? Are there things that are identified in guidelines, local data, things that you may get through your chain? Maybe there's some goals that your larger organization has set. That's a good place to keep track of that, so you can track your performance against it. And then who's going to analyze this data? Who would care about this data? Who would be most interested in it? And so that people know who's responsible for looking at each of those sources. And then likewise, you may collect it at a certain interval, but you may want to analyze it at certain intervals as well. And so determining not only when you're going to collect it, but how you're going to analyze it, because that's the important part. Who you're going to communicate it with once it's analyzed, who would care about this information, who really wants to know. And then how are you going to do that? What's a good way to get that information out most effectively? Probably don't want to have everything just through newsletters. There may be some things that you want to, spread passively or spread passively to some groups, but some of this data you want to think about who actively needs to know. Who do I really need to have that conversation with? Does it need to be at a meeting? Does it need to be, something where we have some time to discuss it? And then the frequency of that communication. So that's how each of these tables are laid out in feedback, data systems, and monitoring. Now on the next slide, that's a picture of page 11. We've basically kind of mocked up each of these examples. So this is an example, just a mocked up example of data sources to analyze performance. And in this situation, we've picked, 5 different data sources that we want to look at. We've looked at the data collection frequency, what we're going to use for benchmarks. Haven't necessarily put a number or a goal on there, although you could choose to do that. Who's going to be the folks analyzing it? How often are they going to do that? Who are we going to communicate it with? And you can see each one of those is a little bit different based on who would care about that meeting, or who would care about that information, and then how it's communicated and when. And again, you can see in some cases, we've maybe picked a little bit more passive way of communicating, putting it on a billboard. In other ones, we've chose to talk about it at staff meetings and places where we really want to discuss it. And most of them have multiple ways that we're suggesting, or not suggesting, but showing as an example of how to communicate. So then, likewise, on page 12, this is the table that looks at data sources to identify risk, laid out just the same as the data sources to analyze performance. Again, we've given you some maybe suggested data sources to start with. Again, please feel free to add, subtract, make that how it makes sense for you. And then on page 13 is just a mocked up version of, what a report like that could look like. Page 14, you're probably started getting the pattern here. Again, is the template for data sources to collect feedback and input. A little shorter list here, because a lot of it is focused on who's our customers, our resident council. We want to get information from our staff. But you may have some ways in your organization that you're already pulling that information, so make sure you think about that. What in your organization, the way you're set up, what's the best way to collect feedback? And so again, then page 15 is just an example of that table being completed. So now let's move into the next section that starts on page 16 of the guide, and that's performance improvement projects. This one is again laid out the same as scope, governance, and leadership, where we have, in this case, 7 different prompts for you to respond to, talking about, how are you going to conduct performance improvement projects, how you're going to identify topics for performance improvement projects, what criteria are you going to use to prioritize which performance improvement projects you're working on, how are you going to use charters, how will they be developed. I'm sure you've heard, if you've listened to some of our other presentations, you've heard us talk about charters and how as we were in the demonstration project and a lot of the homes said, oh, gosh, why do we need to do that? I don't think these are all that helpful. Then by end of the demonstration project, all the homes said, charters are really, really helpful. Probably one of the best tools that we make ourselves use, because it, holds our feet to the fire of what we want to do and makes us really get clear on what we're trying to accomplish. So making sure that you say, how are we going to really, if charters aren't something you're currently using, how are we going to make ourselves build these into our process, because they're very useful. And then how are we going to get our teams? How are we going to identify people to be part of a team? How figure out who those people are that really care about this work? Who are the people that can provide the best information to this team that want to do this work? And then how will they conduct a performance improvement project? How will that team actually do what they're going to do? And then another one that we don't often like to do, but it's how we're going to document and communicate our performance improvement projects. Like many of us who work in performance improvement, the part that we really, really like to do is we like to make the improvements. We don't so much like to actually write it all down, and then 3 years goes by and we say, oh, what did we do? Oh, yeah, where was that? And it's nowhere to be found. So making yourself create some type of way that you're going to capture this information in a succinct way, so that people, when they want to look back at your good work 3 years from now, can actually find it and quickly look at it and learn from it and don't have to reinvent the wheel. In this section, you'll also see a number of tools, and I would really encourage you to look at those. There's the prioritization worksheet that, again, as we've been working with homes, is I think one of the favorite tools of the QAPI tools, because it really, oftentimes you find you've got so many different things that you find you could work on, and it really helps you figure out which one is the most beneficial to your organization right now. Because sometimes it's easy for us just to jump to the performance improvement project that we think we can accomplish or the one that seems the most fun. But really, it helps you sort out which one is really going to give the most benefit to our staff, our residents, and help us improve quality. And then, of course, there's a tool on the Performance Improvement Project Charter and some of the other things that I talked about. Another thing on this section that when I look through it, and as you're starting to get to work on performance improvement projects, it's not a bad idea to, after you get your performance improvement project set up, to look back and say, did we actually do all the things on here? And use what you've put in your QAPI plan in this section as kind of your checks and balances of, do I have my performance improvement project set up the way I want it? Did I hit all these pieces? Because that's not only going to help you get better at performance improvement, it's one of the things that if someone does ask you on a survey for how you're using this, you can say, well, in fact, we have a performance improvement project going right now, and I can show you, here's how we did this, here's how we walked through our plan, and be able to actually show that you hit on each of those pieces that were part of your plan. So it's kind of like when you're doing a math problem and you get the answer, you can plug the answer back in your math problem and do your own self-checking. This is kind of a good section to do your own self-checking. Are you actually following your performance improvement plan? And last but not least is the systematic analysis and systemic action section. And if you remember from the QAPI elements, this is that element that kind of just goes through all the other elements. It's that piece that really, in some ways, is the most challenging to think about, but it's also the part that really hopefully pulls together QAPI for your organization and says, okay, so how are we actually really going to make this how we do our work? And so when you're looking through this section, it's going to ask you, how are you going to use some of these systematic tools? And how are you really going to use what you've done not only to solve a problem that's at hand, but to fend off future problems? We do a lot of root cause analyses and we solve the problem at hand, but that's not valuable if you don't look ahead and say, how are we going to fix the problem to prevent things in the future? And so as you're going through this section, this is another kind of, I'd say, reflective section of when you're looking at your answers, how is this going to come to life in this organization and become part of how you do your work? So that's what I wanted to walk through for each of these pieces. We hope that, the tool is useful. We developed this because as we were listening to folks say, gosh, how do you write this? Where do you start? We said, it probably is helpful to have a template, something to look at. As many of us know, sometimes it's just easier. Somebody gives you something to start with. It's a lot easier to build off of that than to sit there and stare at a blank piece of paper. So hopefully this is a good start so no one is having to sit there looking at a blank piece of paper as they're writing their QAPI plan, and hopefully you can spend more time on the actual content and reflection and figuring out how QAPI is really going to work in your organization. This slide just shows a couple of the dates for upcoming calls. On each of these are not calls where there's going to be presentations. They're really meant to be calls, they're working calls. So as you're working on your plan, call in with questions. If you found things that are helpful that you think we'd like to share, if you've made some modification to what we've put out here that you say, hey, this really works well, I think others would benefit from it, that would be a good place for these calls. I'll be on the call. The rest of our team will be on the call. So it's just an opportunity for you to ask questions. If we've heard any comments, we'll certainly share those, but these aren't required calls. They're meant to be opportunities for you to get some extra assistance and pick our brains and the brains of your colleagues. So I'm going to open it up to turn it over to Christy, and we can open it up to questions and see what's out there.
Thank you very much, Dr. Peterson. So, operator, could you please remind everybody how to get in queue in case they have a question? I don't see any questions that we haven't already answered in the chat. So.
Thank you. If you'd like to ask a question, please press star then 1 on your touchtone phone. If you wish to remove yourself from the queue, please press the pound sign or the hash key. If you are using a speakerphone, you may need to pick up the handset first before pressing the numbers. Once again, if you have a question, please press star then 1 on your touchtone phone.
And while we're waiting for the questions, you will notice on this slide, too, there is an evaluation link on that slide. Please use that link to complete the evaluation. And if you do, after you've completed the evaluation, you will get a certificate with continuing nursing education credits. Also, when you, as you go out of the webinar, the evaluation will pop up. So you'll be able to do it that way. So if you just kind of pay attention as you're going out and fill out the evaluation, it's a real quick evaluation, then you'll be sure to get the credit for this particular webinar. Is there anyone on the phone?
We have a question from Sherry. Your line is open.
Thank you very much. Can you hear me okay?
Yes.
Yep, we can.
Okay. Okay, thanks. So I like to champion with process improvement projects that last part of sustaining the gains after you do all that good work and put different standard work into your process. Where do you think, if appropriate, sustaining the gains and reporting out on auditing improvements that have been made should fit into a written QAPI plan?
I think it could go probably in either the performance improvement piece when you're talking about the documenting. The initial tool didn't really get into that so much. I also think it could really go in the systematic analysis and systemic action piece.
Okay.
Is how you're going to, and you can obviously add sections to this. But I think that is a good point because, often in quality, like you say, we do the project and we don't realize it's almost another project to do that sustaining spreads in your organization. And sometimes having really almost like another project plan or a process to make sure that happens really helps get things to stick. That might mean you may even add some other team members, change the team. The team that does the sustaining and spreading may be different than the team that really worked on the project initially. So I think it could fit in either place. And if that's something that as you're working through and you find a way to word it, I think that'd be a great thing to share with the group. That'd be a great addition. Anyone else have any thoughts on that?
Thank you. And once again, if you have a question, please press star then 1. We have a question from Shannon. Your line is open.
Hi. Thank you all. I just want to, it's more of a comment than anything and then just a short question. So I have been just dying waiting for something like this education for the past year. I developed a policy for our facility, and we do performance improvement projects all the time, and so I've got a folder, full of that stuff, but just couldn't put together the concept of putting together an actual plan. So I do want to thank you so much for this. Would you recommend that facilities also have a policy and procedure regarding their QAPI program?
Why, I don't think about that one. I think that's a big policy and procedure, to tell you the truth. I always chafe a little bit at the term QAPI program, and I know that's the way the regulation will probably come out written, because I like to think of QAPI not as a program, but instead kind of really how we do our work. If I was going to kind of write something in addition to this, it may be more how often do we actually look at this? How do we update it? What's the process that we go through for keeping our QAPI plan fresh?
Okay. Okay.
So
I think I could, yeah.
Yeah, and then I also think that, your QAPI plan isn't a work plan. It's really meant to be if somebody new comes into your organization and they can read through it, pretty quickly and say, oh, okay, I get it. This kind of stuff they're looking at, kind of here's how we're doing this, here's the process we go through. But you may also have other things that are much more of a work plan, where some of that detail-y things that you don't want to have to be updating your plan with all the day-to-day nitty-gritty of how you do small tests of change in your organization, or whatever. So you may have some actual kind of work plans or other processes that you do as part of quality that you don't necessarily detail out in here. Does that make any sense?
Yeah, I think it does. That makes very good sense. So, and I agree with you. I think I could probably shorten my policy now, and just make that really kind of general, and then develop this plan, and then I would have, another area for the projects that we're actually working on and measuring, and okay.
Yeah,
okay.
That's how I don't know if anyone else for the team here, Christy and Kathy are nodding as you're talking. So,
yeah, this is Kathy Nicholson. As a former DON who's written a lot of policies and procedures, I really see this written plan, if you do all the sections of it, really is a replacement for a policy and procedure, because it does go into how you're going to organize, how you're going to do the big process things in it. And it also includes a section as to how often you're going to review this plan, which is really what a policy and procedure is. Yep. It's just a little broader approach than that typical piece, and as Jane so eloquently said, you're going to have the detail. You don't want to include the details of your most current PIP in your policy and procedure. There's no reason to do that. This plan is really meant to be an overview of the process.
Okay. Very good. Thank you so much.
Good use of it.
Jane, there's a question on chat. How do we convert our current QI project into a PIP? Isn't this just more paper compliance?
I don't think you need to convert your current QI projects into a PIP. I look at a PIP as it's another terminology for a QI project. You can call them QA projects, you can call them performance improvement projects. They're at the end of the day, they're the same thing. As you go forward and you're doing, improvement projects, what in QAPI we really encourage is to, use some of those tools like the charter, use the prioritization tool to determine what's the most important for you to be working on. Because those help give you that structure. They help work on that systems thinking, that you're being very planful about the things you're working on. But, you're going to use this, it's all about then choosing, okay, what am I working on? Which are the tools for this project that are going to be useful? So if you're doing a quality improvement project, you're doing a performance improvement project. It's the same thing.
And then is there a date for this to be mandated?
Not that I have heard.
No.
I think it's good, if the rule comes out in September,
which is
the
latest we're hearing.
Yeah. So we'll see. If we had a crystal ball, we could answer that one.
We stopped trying to answer that question because every time we do, it hasn't come to fruition.
Yeah.
So, anyway, but good question. Jason, are there any other questions in queue?
Yes, we have a question from Becky. Your line is open. Becky, please ensure that you are not muted.
Okay, well, while Becky maybe figures that out, here's another question. Our organization has developed a company QAPI plan. How do you feel about individual skilled nursing facilities that add or change to this plan to make it facility specific?
I think your QAPI plan should be facility specific. And I know, a number of the corporations wanted to do a similar thing to what we're doing here, to give their facilities some type of template, something to go on, because again, it's staring at that blank piece of paper is kind of daunting. But if someone's going to look at your plan, they really are going to say, now, how are you following this plan? So I would highly encourage, if you have a QAPI plan that's been started at the corporate level, for you to really look through there and modify it to make it specific so that it really is what you are doing at your organization, and it's not so generic that someone isn't able to understand how your organization is uniquely doing QAPI and helping it be, really guide your work.
Jason, anyone else on the phone?
No, we have no further questions in the queue.
Okay. Good. I think we had some really good questions.
We
so
did.
I thank you for that discussion. And I have a feeling as you start working on this and digging into it, you're going to have some more questions. So that's why we're having these calls. Our next one there's 2 calls, and again, they're totally optional. You don't have to go to both of them, but there's one on August 31st and then another one on September 8th. You can see the call-in information here on the slide. And, feel free to, and even if you just want to call and listen in to see if you missed something, you don't want to miss anything, I'd encourage you to be on that call. Jane will be on the call. She'll answer these kind of questions, and we hope you'll find it helpful. Okay, so this does conclude our educational section. We want to thank you again, Jane, for speaking with us today. As I mentioned, as you exit from the webinar, there's going to be a window that will open for a short evaluation, but it's also included on this slide. So please do take a minute to provide feedback. We really do appreciate it. We really do read what you say. And as a matter of fact, this webinar, or this whole idea for the QAPI plan came from suggestions that we heard from you all, that you really needed help with that, and we wanted to respond to that. So we do really care about how we can best help you in the National Nursing Home Quality Care Collaborative. This session, we did record it, and it will be available on Lake Superior Quinn website probably within 2 weeks at the longest. So you'll be able to listen to that again, maybe share it with team members who weren't able to participate today. I just want to check one more time, Jason, did any more questions come up?
Yes, we have Becky back in the queue. Becky, your line is open.
Good.
Thank you very much. I cut myself off a while ago. I was just questioning about the tool. For some reason, I don't have access to the tool, or I don't know where it's located that you were discussing today.
The how-to guide, or?
Right, the how-to guide, I guess, where you referred to a couple of times.
Oh, yeah. You should have gotten it with the sign-in information.
Were you able to read in the chat? I also, we shared a link. But better yet, if you want to, I can send it to you.
Yeah.
If you want me to. You could either put your email here in the chat box or just tell it to me.
Mm-hmm. Are you online right now watching the presentation?
Yes, I am. I put my email in the question answer. I guess I need to put it in the chat box.
Oh, okay. Oh, maybe put the Q&A down. Let's see here. Just done that arrow, right?
Oh, I'm sorry. Okay, so you're Lori?
No, I'm Becky.
You're Becky.
Oh, well, wait a minute. Maybe it's right up above there. I'm sorry. I see never mind. I see it. Just Did you
Got it? You find it?
Yeah, thank you very much.
You're welcome.
Thank
Also,
you.
you can find it if you go to the Lake Superior Quinn website. It's there too. Or what state are you from? Because you can also, I'm changing the slide here, and here is all this information depending on what state you're from. This is the contact information for each of the leads in each of these states, and if you need any of this information, any links, any handouts, if you contact Kathleen in Michigan, me in Minnesota, or Emily in Wisconsin, we'd be glad to help you find what you're looking for. Any other questions?
We have no further questions in the queue.
Okay, perfect. All right, everyone. Thank you very much for participating, and you all have a great afternoon. And good luck writing your plans.
Thank you, ladies and gentlemen. This concludes today's conference. Thank you for participating. You may now disconnect.